the factors that have come together in this pandemic, I don't think we've had an example of this on this scale in our history. Back in November, CGU established a partnership with Riverside University Health System to assist them in understanding the acceptance of a COVID vaccination among their employees. So the employees of Riverside University Health System span from doctors and nurses to administrative assistants to people who work in cafeterias and other capacities there. So we think that this in part does reflect a cross-section of the Riverside population. So we developed a survey in order to assess whether employees would be open to taking a vaccine, whether and understanding some of the reasons that would drive their accepting the vaccine, refusing the vaccine, or being hesitant about taking the vaccine. From that survey, we learned that there are a portion of the population who are unlikely to accept the vaccine. We learned that there's a proportion who are likely to be hesitant, but overwhelmingly the majority, about 80% of those surveyed, in fact, had either been vaccinated or were planning to be vaccinated. And overall, we found that in the group who was accepting the vaccination, we found that there were not necessarily one set of reasons that motivated them. We found in general that they appeared to have an altruistic motivation. So they reported being influenced by having a family member who had COVID or a colleague who encouraged them to be vaccinated. We also found that they tended to be more open to receiving information from their healthcare providers. So we saw an openness to science and medicine. In the group who was hesitant, we saw a very different pattern. So across the reasons that we asked, we found that they essentially reported being unsure. So it seemed that no matter what reason we were presenting, pretty much down the middle, they were reporting that it didn't necessarily sway them one way or another. In the group that reported refusing a vaccination, no matter what reason we presented, they reported that it definitely would not influence their decision. We've also started to look at demographic factors and knowledge among the three groups, so those that either accept vaccination, are hesitant, or refuse it. And so far, our data seem to suggest that among those who are hesitant, there seems to be lower levels of knowledge about COVID-19. So this opens up an opportunity for us to develop educational interventions. This suggests that perhaps in this group, by increasing knowledge and information, this might help to shift the decision-making towards receiving a COVID vaccine. There's a reason why we're taking this gradually, at least initially, with opening back up in the context of vaccination. We need to look at the data and see what the data is suggesting, because remember, from the perspective of clinical trials of vaccines told us that the vaccines were preventing people from getting very sick. So in other words, vaccination was keeping people out of the hospital and from developing severe disease. What we didn't quite know from the clinical trials was whether the vaccines were going to prevent the disease from being transmitted between people. And so it has been the case that we've had to see what the data suggests as more and more people are getting vaccinated. And some of the initial studies do seem to suggest that the vaccines are protecting us from the disease being transmitted between people. So that's very good news. That's very good information to know. Without the vaccine being administered on a large population scale, we wouldn't necessarily know that. There's a reason why we're taking this incrementally. So rather than just flipping the switch and opening up immediately, we have to allow for vaccines to reach the population, for one. We have to make sure that sufficient numbers of people are vaccinated. We also have to give some time for the vaccines to work, meaning, to provoke immunity. So we have to allow about 2 weeks after the person has received their second dose, if it's the Pfizer or the Moderna vaccine, or 2 weeks after they've received the single dose of the Johnson & Johnson. So I think now in the middle of May, we're projecting that in Los Angeles County, we may reach herd immunity by the middle to the end of July, and the number that we're targeting is about 75% of the population who's eligible to be vaccinated being vaccinated. So that may be a very realistic goal for Los Angeles County within the next few months.